Your symptoms is your doctor going, hey, listen to me. So listen to Carrie. She's going to talk to us about ways to take care of adrenal fatigue. I like to call it, functional medicine causes adrenal exhaustion. It's like, but I understand the NEM system. So anyway, can you tell us how to take care of this naturally?
Yeah, so like the first step is to really see that your symptoms are your friends, right? It's your body's telling you something, and so you have to listen to it. It's whispering.
Warning, warning. As a medical doctor, I must inform you that there are side effects to this coaching session. Beware. It may enhance your self-esteem, cause you to experience vibrant health, encounter long-term weight loss, heal damaged relationships. Warning, there are side effects to this coaching session. It may increase your enthusiasm for life and bring about hope. It may cause you to have productive and optimistic thinking. It could even help you not allow messed up people to ruin the rest of your life, and help you realize the masterpiece that you are, and empower you to be the boss of your brain. Warning, these side effects may be long-term. This is Dr. Isabel from Doctoronamission.com. Hi, Carrie. How are you doing?
I'm very good. Hi, Isabel.
How's that 3-month-old doing?
Oh, she's a blessing. Definitely getting used to her sleep changing, but it's really amazing because it's like a new thing every day. It's something new. It changes, you're just adapting, and having to see her face every day is just amazing. Thanks for asking.
Isn't it beautiful when she smiled at you?
I know, that's like the best thing.
It's like, oh my gosh, does it get any?
Smiles.
I know.
No, it doesn't. Even her cries are cute, I like to let her cry. I'm like laughing at her. No, it's really cute.
Oh, you're so funny. And what about the sleep? Is she sleeping through the night? Are you that blessed that she's really?
Well, I mean, we'll say maybe it ranges from 4 to 8 hours. So definitely night to night, we're still getting used to it.
Hey,
but her 8 hours is different than my 8 hours. So it doesn't line up. You're still waking up in the middle of the night, but it's okay. It's just amazing.
Oh, so good. What a blessing, children. I love them.
Thank you.
But I sure am glad I'll never have to be pregnant again. Just saying.
How many do you have? How many do you have?
Just 2. That's all my body could do.
That's good enough.
I'm one of these that has 36-hour labors. So yes. I know your labor was only 5. You are blessed.
I am very blessed.
I'm so happy for you.
Thank you. Thank you. Well, I prepared, my body. I'm not sure if it was a preparation, but, I did something called Hypno Birthing, where I really, you believe that birthing, our bodies were made to birth, right? We are females. God made us this way, and we are strong. We're not like in the movies that say birthing is so scary and it's you're going to go through a lot of pain. No, it's a wonderful process. And if you truly believe that, the endorphins will come out and your dopamine, and you're just like, I get to meet my baby today, and you breathe through it. I did it all natural, and it was just amazing. It's an amazing process. And after I did it, I was like, I can do this again. It's not something scary that women have to like be afraid of the birth. And so I definitely, would recommend anyone to look into Hypno Birthing.
Where would they find that? Where would they find Hypno Birthing?
Oh, I just watched a bunch of YouTube videos, and so you can really educate yourself on how to prepare your mindset, because instead of saying contractions, they say surges. Instead of saying pain, you say pressure, and so you just changing your mindset in that I am ready, and I can push, but I can also like get to see my baby today, and I can do this. So it's very empowering for women to be able to do this.
I wish I would have heard about that when I birthed my first baby in 1994.
I know. I don't know if it was Maybe it was, but
I don't think YouTube was even around, but
no,
anyway.
exactly.
Carrie, how about if I introduce you to our listeners at the MD and Chef
Sure.
team? Okay. Hello, everyone. I'm Dr. Isabel, your host at the MD and Chef team. And today we get to talk to Dr. Carrie Lam from California. And I just want to share with you a little bit about her, what she has done. And then she'll tell us a little bit about her story because she's got an amazing story. She's a doctor of medicine and she got trained at Loma Linda University in California. She is board certified in family medicine, anti-aging, and regenerative medicine. She's also written a book, which is so cool. And it's, let me see, it is called, what is it called?
Adrenal Fatigue Syndrome Cookbook, which I have helped my mother, who's a dietitian, and my dad, who's also a medical doctor, write. And then I've also written the Advanced Symptoms of Adrenal Fatigue Syndrome.
Great. And we'll be talking a little bit about that in just a little bit.
Perfect.
Thank you for that. And she's also part of the Lam Clinic, which is a team of physicians and health professionals who have over a half a century of combined clinical practice together. So that is amazing. It's a family business, isn't it?
It is family. We're all together.
And your father is a medical doctor in?
Yeah, he's a MD, but he decided to actually just do nutritional coaching for the past 15 years, really, in order to help people all over the world. And so he's kind of a pioneer when he was one of the first telephone coaches when there was no such thing as coaching or internet, So
Yeah.
He's definitely been doing it for quite a long time, and I've been under his wing. And so we've learned so much about integrative medicine and helping a lot of people with adrenal fatigue. And so yeah, if people want to get a hold of the Adrenal Fatigue Syndrome book or even the cookbook, we'll share the link, lamclinic.com/gift, and you have access to those two ebooks.
Yes,
online.
and that'll be in the show notes. Promise. So tell us a little bit about how you got interested in integrative/functional medicine.
Right. It's how cliche is like, why did you go into medicine? And I just said, I've always wanted to be a doctor. Most likely because my dad is a medical doctor and he has been doing integrative medicine for a long time. And so I learned from him. And specifically for adrenal fatigue, how we got into that is because he actually got adrenal fatigue and he was a sufferer and he went through the whole conventional system and, he started getting palpitations and they just put him on beta blockers and he's like, this is not helping me. I still get my palpitations. I'm not getting better. And so went through the conventional, didn't find anything. So he did a lot of his own research in how to naturally help your body with its stress response. And so we've come up with this neuroendometabolic stress response. And he got better with the help of nutrition and supplements and lifestyle changes. And so me seeing that and seeing how medicine is not only giving medications to patch symptoms, it really is a whole person approach, whether it's physical, emotional, social, behavioral. You need a whole approach to helping the person get better. And so I went to medical school already knowing that I wanted to do integrative medicine, even though we don't get the training in medical school, right? We get maybe 1 hour of nutrition class and nothing on business or nothing on integrative or use of supplements or things like that. And so I had to learn by myself or from my dad, who has lots and lots of knowledge from doing lots of research. And so it is a self journey to be able to come and help people with adrenal fatigue. And so we've been really helping so many people get over their fatigue step by step.
Oh, I love that. Oh, Carrie, I so understand to be in medical training, you and I, when we know that we know that we know there's a better way.
Yes.
I'm like you. I wanted to be a doctor ever since I was 5 years old because I had this uncle. He was the doctor in our family, and he would like light up the room and just make you so happy. And I was like, I want to be like him. And and that I get that. And before I decided to get the courage to go to medical school, I said, oh, I can't do medical school. I'll do naturopathic medicine because that's more alternate, that's more holistic and stuff. And luckily, by the grace of God, I had this anatomy professor who said, why are you going to be a naturopath? Why don't you become a medical doctor? And he said, and I'm so glad he said this, if you want to change the world, you need to be a medical doctor. You can't be a naturopath doctor. And I'm not downing naturopath doctor, okay? But
Yeah,
you and I both know the training
I
we
went through
got.
the same thing. Yeah.
Yeah.
It's a decision, unfortunately, for our society that has to accept MDs over naturopaths. It's very sad, you know.
Yes.
But we have to, and we at least we got the education to be able to use the conventional and use and integrate it with the natural. So we got the best of both worlds. So that's
Yes, we
good.
do. We do. And oh, but wasn't it painful?
Yes.
Yes. Okay. So I wanted to ask you, what's the difference? Can you explain the difference between adrenal fatigue and chronic fatigue?
Right. So, you know, in our medical ICD-10, which is the way we code diagnoses, you're based on insurance billing. Adrenal fatigue is not found in there. Only chronic fatigue syndrome is found in there. And it's still a diagnosis kind of exclusion. You come in fatigued, and chronic fatigue has a definition. So it's you have to be fatigued for more than 6 months and either have some kind of postural lightheadedness, like if you bend down and you stand up too quickly, you kind of black out, or you can also have exercise intolerance. So that sounds like so many people that I know, and you can just be diagnosed with chronic fatigue with those criteria. Um, and then when we talked about adrenal fatigue, what happens is that it ended up being just a catch-all for the people who are fatigued, who have went to their doctor and got placed on maybe thyroid medication, not feeling better, continue to be fatigued, and they don't know why, right? They still tired and maybe wired, and they're not improving. And so there's this bell curve of people, right? You know, conventional medicine can really help maybe 95% of people, but then the sides, the 2.5% on each side, they get cast to the side because no one knows how to help them. So those are the type of people that we end up seeing. And adrenal fatigue can be used as a term under chronic fatigue. Chronic fatigue is basically just the medical diagnosis. And if you have adrenal fatigue, we or like James Wilson, the founder of adrenal fatigue, he originally coined a term because adrenals are the place that produces cortisol, right? They're the glands that sit on top of your kidneys. Your adrenals actually produce over 50 hormones: cortisol, estrogen, progesterone, DHEA, testosterone. So, but we have found now that when your adrenals are under stress, you continue to put out epinephrine, which also comes from your adrenals. Norepinephrine comes from your brain. And then when you have a lot of epinephrine going around, like when you're trying to fight or fly away from something, so if your boss screams at you, or if you see a bear, this epinephrine goes out. It's a normal response. However, if you continue to fight and fight and fight, or you have a fight and flight, then your body has this overreactive sympathetic response. And how does it respond to that? You need to put out cortisol to be less inflammatory. So the epinephrine can be very inflammatory. Imagine you're just like when you have someone who their heart stops, you give them CPR, but you also give them epinephrine to get the circulation going. It constricts all your blood vessels in order to go to your heart. And so epinephrine can be very inflammatory. So cortisol is there to help reduce that inflammation. However, as you continue to go day in, day out with chronic stress, your adrenals get tired of producing cortisol. That's how he came up with the term adrenal fatigue. And you can look at the adrenal levels with the saliva cortisol, you know, throughout the day. And you can see that different people actually have different cortisol levels, whether it's high in the morning and it's supposed to come down all throughout the day. But some people, they have high cortisol at night, and that causes them to wake up or wake up in the middle of the night. And so the cortisol is one good way to see where your adrenal function is, but I've also seen many people with flat line. They're not being able to produce any cortisol. And we have to say, hey, is it because your adrenals are just, they don't have the right nutrients? They're tired of producing, you're under chronic stress. And so I've kind of gone away from adrenal fatigue because as a term only, and use this whole stress response term because it's not only about the cortisol or the hormones, right? Your whole system is involved. So in our neuro, endo, metabolic stress response, we have the neuroendocrine part, which is the HPA axis, the hypothalamus, pituitary, adrenal, cortisol. And then you also have the brain, the cardiovascular side of things. Then you have the metabolic side that comes a little later with stress response. So the gut, the microbiome, the detox pathways, the inflammation, and your bioenergetic circuit, which is the metabolism with diabetes and things like that. So it's very important to have this whole big picture when you're looking at a stress responding in your body. I know it's very wordy, but that's kind of how we've come to our stress response in helping people get to the root cause.
It's just essentially a hot basket mess, and you got to fix it up.
You got it. That's right.
Yeah.
I know. And there's so many big terms, but you're right. It's just stress affects your body in some way, and we have to figure out where the stress is affecting the most and then tackle it in that sense. You're right.
And to give people hope, because I was the one with the flat line of cortisol, and to give people hope, Carrie's going to talk to us about how you can take care of this naturally, because there is hope. Now, you don't get it taken care of in 1 hour. You don't
Definitely
get it
not.
taken care of in 1 month. Sometimes it can take up to 18 months to 24
You're
months.
right.
But the key is your body is yelling at you, screaming at you to pay attention. Your symptoms is the doctor
Our
inside
friends.
of you. Yeah, your symptoms. Yeah, your symptoms is your doctor going, hey, listen to me. So listen to Carrie. She's going to talk to us about ways to take care of adrenal fatigue. I like to call it, functional medicine calls it adrenal exhaustion. You know, it's like, but I understand the NEM system. So anyway, can you tell us how to take care of this naturally?
Yeah, so like the first step is to really see that your symptoms are your friends, right? It's your body's telling you something, and so you have to listen to it. It's whispering. And a lot of times, if you go to a doctor, they might not understand. Oh, you have palpitations, let me send you to a cardiologist. Oh, you have bloating, let me send you to a gastroenterologist. Oh, you you have a thyroid issue, go to an endocrinologist. But no, it's important to see that all these symptoms that you're having are connected to each other. And it's not just one piecemeal patching of symptoms because with medications. And so the first step is really to say, you compile all your symptoms and you say, okay, well, how are these all related to each other? And how can I find someone to be able to help me? Because it is very convoluted sometimes, right? And then it's also important to know for your adrenals that you need certain nutrients, right? And these nutrients need to be produced. They're not produced in your body. So let's say vitamin C is very important to your adrenals function because it's a cofactor to make all hormones, like we talked about, all 50 hormones. And so, but some people cannot tolerate certain types of vitamin C. They get overstimulated. It causes them difficulty sleeping. Or some people can tolerate a lot higher doses, and others are very, very sensitive. And so you have to figure out where you're at and do the right delivery of these types of nutrients and know how to take them. It's not just, oh, go take vitamin C, because that doesn't ever work because every person is so different. So for my patients, I have them on so many different types and different types of dosing also because they deliver it differently. So whether it's liposomal, whether it's fat soluble, whether it's water soluble, we do a whole combination of types of ascorbic acid for you to help your adrenals out. And your adrenals also need pantethine, pantothenic acid, and vitamin B5 as another cofactor in order to help your adrenals produce the hormones. A lot of times when I see patients, they come to me actually already on thyroid, already on hormones, and maybe they're on adaptogens and like ashwagandha, rhodiola, and they're overstimulated and they're taking too much because your adrenals need the raw ingredients in order to help produce its own hormones.
Mm.
And so it's very important to know where to start and what to take first. If you just take thyroid, if you just take hormones, you're basically telling your adrenals not to produce its own hormones, right? And so there is a time and place for them, but I like to start from the base, and it's important to deal with the foundation first before you start stacking all of those. And that includes glandulars, because glandulars is very stimulating for someone who's very strong and healthy. Sure, they can do it. But someone who's very sensitive, that is not where they should be starting. And so a lot of my patients also have paradoxical reactions. They're very sensitive to supplements, very sensitive to medications. They have to take baby doses, or they have paradoxical reactions. And what is the reason behind that is actually a detox pathway issue. They're so full of toxins. It's like their body is a trash can, and it's full of trash. So even if you want to put, something like water, which is good for them, or something like a nutrient that's good for them, it's just going to overflow. And so it's not the problem with the nutrient, but it's the fact that their body is just so congested, like a highway that's just congested with cars. So you need to clear the highway first, and then the cars can get moving, So that's also very important to know the dosing and the delivery form and what type of nutrients, and in addition to listening to your body's symptoms that it's telling you. And then we have our neuroendometabolic therapy, which is really just this whole person look and seeing, hey, which circuit do we need to deal with first? Is it the hormone pathway? Is it your detox pathway like we talked about? Is it the gut, okay, with the microbiome and your inflammatory pathways? Is it your neuro pathways? And so because your body will be showing up different symptoms at different times, and certain people need to deal with this one first, and certain people need to deal with that one first. And so making sure you understand, not only looking the whole picture, but dealing with whatever is dealing with your most primary dysfunction is very important. And so it is very hard to do this by yourself. Like I know people are just like, where do I start? And that's why I try not to have people
Overwhelm.
self-navigate,
No,
and they
yeah.
can definitely, there's so much information out there. It's just you don't know what is right or what is wrong, because like it might be right for somebody, it might not be right for you, right? So it's important to get a coach or a doctor or a healthcare practitioner who understands what you're going through, who can test, give you challenges to understand your body. The way we help our patients is we give you something, but we challenge you to make sure it's working well. We see how you react, we back down if we need to. It's not just go 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 and keep increasing. It's very important to also press on the brakes and listen to your body if it's overloaded. So find someone who really understands. Like I said, we see patients all over the world, right? We do telemedicine, and you can definitely help. We can definitely help people. And like you said, it's not a quick fix, really. It's going to take a year or maybe more than that. And you have to be a good follower and understand. Yeah, a good student. And learning is like so key to healing, right? And so I think it's important to find the help you need if you are struggling, and don't just self-navigate, because that could actually worsen your spiral.
So true. So true. And do you ever incorporate any limbic system work?
I do refer people, like, DNRS is very important.
Oh, I did DNRS. She really, Annie. So what's DNRS? DNRS is dynamic neural retraining system, because your brain is plastic and you can retrain your brain, and past stuff can affect your adrenals. They all talk. They're constantly talking all day long. So if you learn, so just so everybody knows, there's this DNRS by Annie Hopper online.
Mhm.
And she has an online course, and you can
Mhm.
do it in the privacy of your own home. So, and it's work, but it really helps you shift and get out of that rut. Who
Yes.
would have ever known? I mean, you don't learn these things until you learn it. So
No.
your father, how's your father doing now?
It's great. Yeah, he's doing great. And definitely, I would say he's helping me, with knowledge as we continue to build our clinic and educate. He's a great teacher, and he's definitely. We have this online website with thousands and thousands of articles in order to continue to teach people that hey,
Yes.
you're not alone. There's hope for you, and so definitely, he's keeping busy in that way and helping lots of people. And functionally great. He's going bike riding and everything. So
And how old is he?
he's 66.
Good for him. And he probably will
Yeah.
never retire, right? He'll just keep on
No.
doing this until his last breath.
Yeah, definitely.
And I wanted to ask you, how do you figure out whether it's your thyroid, your adrenals, or your reproductive system that's causing the adrenal
Hmm.
exhaustion, adrenal fatigue, the
Yeah, great
NEM
question.
imbalance?
Yeah, so those three are our three legs of the stool, I like to say, for our hormone circuit. And so our hormone circuit includes the adrenals, like which can be cortisol, aldosterone, for cell balancing and all the reproductive hormones. Then you have your thyroid, okay, your thyroid gland for metabolism and thyroid hormone. And then you have your reproductive organs. For females, it's the ovaries, and for men, it's the testes. And so all three need to be working well in order to give your body the wellness that it needs. Um, when one is off, you're going to feel and fall off your stool and not feel great.
Mm.
Okay. And so, how do you know if it's the thyroid? Usually, you can do blood tests. Okay. Whether it's the thyroid stimulating hormone or antibodies like the TPO, thyroid peroxidase antibodies, or thyroglobulin antibodies, and also running the free hormones and the total hormones from your thyroid, in addition to a reverse T3. That's what I would recommend for thyroid, looking at your thyroid. That is important to see how your function is, and not just go by the regular reference ranges that the labs give you, but hey, there are optimal ranges that you can shoot for. And so, just depending on where you're at, or how the lab is done, you should find a functional doctor who understands those ranges. But also know that your thyroid can look off. The thyroid numbers can look off if you have immune issues. So, like food sensitivities, or your gut is not healthy, or if you have adrenal problems and you're not getting to the root cause of that, then your thyroid also can the numbers can look off. So I usually don't just start with thyroid. I always look at the adrenals. And hey, is your adrenals and your cortisol curve looking good? And you can do a saliva test in order to look at your cortisol curve throughout the day. A 4-point is great, because it's supposed to start high in the morning to wake you up. And then it wanes throughout the day in order to get you ready for bed, okay? But if you look at your cortisol curve and it's like either all low or all high, or you have a reverse curve, you definitely need to deal with adrenals first before you deal with the thyroid, okay? But if you're already on thyroid medication, I usually continue, okay? Because we don't want to have too many moving parts. Just know that if you're on thyroid medication and you don't feel better, and you're like, why am I still gaining weight and fatigued? Then you want to dig a little deeper. Maybe it's an adrenal issue. And then when I say reproductive organs, a lot of time when you're menopausal, for women, they start to actually reduce in their estrogen and progesterone production. Like you said, progesterone stops, really reduces over time, like even 10 years before you hit menopause, right? So it's important to help support your reproductive organs. And if you will go through menopause, then know that, hey, your adrenals are the only ones producing progesterone, DHEA, testosterone. Your fat cells can also produce estrogen, but the wrong type usually, okay? So helping your adrenal function will be very key in helping the thyroid function better, and also your reproductive organs work better. And usually saliva tests are great for also looking at the free and active form of your reproductive hormones, because when you draw them by blood, they are the total form, which can also give us another picture, but usually it's good to get both, right? Not the total and also the free and active form.
Yes, and the reverse T3, have you found that the reverse T3, when it's elevated, you're finding a lot of toxins too?
Reverse T3 can be, yes, more of a marker of either toxins, but also maybe your adrenals need help. Something else other than your thyroid is slowing it down. So it's important to look at and reverse T3 if it's elevated. Hey, what else other than the thyroid can be causing this?
And when Carrie's talking about all these tests, just know that these are tests that are taught in medical training. It's for an endocrinologist. These are specialized tests that an endocrinologist will do. Usually a GP or a family practice doctor doesn't do the whole gamut of the thyroid, your free T3, your free T4, your reverse T.
Or a functional doctor. A functional doctor will do it, but not a conventional doctor.
No,
you know?
They usually go, no, it's too complicated. Well, guess
Just
what?
a TSH.
Yeah. And then also for TSH, normally you want it around 2. You don't want, what number do you like?
Yeah, around 2, but you know, it's very person dependent. And so if someone had a TSH of 3, but really I look at the whole picture, like how their thyroid hormones are, how their cortisol is, I'm not just going to start someone on thyroid medication or glandulars or anything to stimulate them more when their TSH is kind of borderline. You know, that's not how I work. We want your body to be able to produce its own. So that's a very key way of looking at things.
So you
not just the lab values, you know, like I see how the patient is doing.
Right. But I guess the big point is if your TSH is 5, that's not optimal. So start looking, because there's a lot of doctors that say, oh, your TSH is 5, you're fine, don't worry about it. But really, that's showing signs that something going on.
You're right.
So I always like here at the MD and Chef team is to give our listeners 3 action steps that they can take home and start winning right away. What 3 action steps can you share with us today, Carrie?
Right. So definitely, you know, if you have a stress response, it's very important to do breathing. It's probably it's free and it's the most effective for bringing your sympathetic response down. So you can do adrenal breathing, we like to call it, or just bring your parasympathetics up in order to get your cortisol levels down. And so breathing is very, very simple and easy to do. You can also, like we talked about symptoms.
Before we go on to number 2, how would you breathe? Can you give us a simple example of the breathing?
So
we can do it together.
Yeah. So when you're breathing, you're really focusing on your diaphragm going down and your belly coming out. And so you want to do 70% of a breath. You don't want to just take a full deep breath, because that can actually be very activating also. So if you're someone who's sensitive, you don't want to take a full deep breath. Like we deal with super sensitive people, like we call ourselves the ICU of adrenal fatigue, people who can crash even from the wrong type of breathing. So it's important that, yeah, we can do it together where you breathe and in, and then you kind of look at it as cyclical, and you come out and you breathe out, but you want to have your belly come out and the diaphragm come down. We actually have an app, Dr. Lam's Adrenal Breathing, so you can look at that on the phone if you wanted to look at that, to someone to coach you through the breathing. But the importance of the diaphragm coming down is because of the vagal nerve actually running through the diaphragm. And vagal is important for parasympathetics, which is rest and digest, yes, and calming yourself down. And so I would say that's probably one of the most easy and important things you can do. Do you want to do it together?
Sure. We can do it together. Listeners, join in.
So you're going to take a deep breath, but only to 70%. And then you're going to breathe out. You kind of thinking you're going over the moon and coming down, and you're feeling your whole belly come out. And then you take a deep breath in again, feel your belly come out, and then you take a breath out, and your belly goes back in. So this abdominal breathing is very important for helping your relaxation.
Great.
So that's the first step, to breathe. Second step is to listen to your symptoms, right? If you're having these symptoms that they don't seem like they're intercorrelated, keep a diary. It's very important to keep track, whether it's food that you may be sensitive to, or people that stress you out, whether it's your job or how you emotionally are feeling, how your sleep is. Keeping a diary of your symptoms is very important because you are learning. Education is key. Like I keep saying, is you have a body in order to be an advocate. Or else you go to a doctor and they're just going to send you to different, specialists, and you don't know what's going on. When the big picture is that there is a big picture and something is going on. You just have to find at the root cause. And then the third takeaway point is really, if you are struggling, you don't know what to do, you're tired of all this information going on, find someone who knows, right? Who can help you through this, whether it's a coach or a healthcare practitioner or a doctor who understands adrenal fatigue. So you don't feel like, hey, I'm fighting against the medical system. No one cares for me. No, my doctor doesn't understand adrenal fatigue. And so you need to find people who are like-minded, who can help you through, who understands the dosing and the delivery and how to get your body where it needs to get functionally, slowly and steadily, and work on the whole big picture rather than just little by little, one thing at a time, And so whether it's finding someone like Dr. Isabel to do coaching, or for me, like to do telemedicine, there's so much help out there. And if you are interested, definitely look up Lam Clinic, lamclinic.com, and we'll be there to give you hope and to be able to help you out. And like I said, you can get our free adrenal fatigue starter kit at lamclinic.com/gift. And that's our adrenal fatigue syndrome book. It's basically a 500-page book to be able to tell you what adrenal fatigue is, and also a cookbook, an e-cookbook, where, hey, we'll be able to share with you recipes to reclaim your energy, and it's by symptoms. So if you're feeling hypoglycemic, we have recipes for that. If you have problems sleeping, we have recipes for that, and so it's just, it's symptom based. And so it's very good resources for you guys listening.
Great, thank you. And all those links will be in the show notes, everybody.
Perfect.
All right. Thank you so much, Carrie. Do I hear your little baby crying?
Yes. Yeah, she's crying. So we need to go help her out.
Yeah, you got to go. Okay, well, I'm going to let you go. Thank you so much for your time. You're such a blessing to the world. And I know that you and your family are going to help millions of people in this world reclaim their health.
Thank you so much. Thank you
You're
so
welcome.
much.
Thank you, everyone, for joining me. I'm Dr. Isabel, and you're at the MD and Chef team. And next week, I don't know what's coming up, but it'll be amazing. Until then, have a super fantastic day. And remember, you are an unrepeatable miracle. We need you in this world. Please know that you are important. Remain unstoppable. Mwah. Love you. Bye-bye.